Chairman, we're ready to begin.
Thank you, Denisha, and good morning to everyone. Denisha, would you call the roll of the board members, please?
Yes, Chairman. Norman Boyd,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Tommy Hopkins,
Here.
Nelva Lee, Shane Mobley, Robert Coles, and Cynthia Rucker. Chairman, that concludes my roll call.
Thank you, Denisha. We do have a quorum to conduct business. Is that correct?
Yes, Chairman.
Thank you. Welcome to the board members and other people listening in this morning. We our agenda today consists of only really one agenda item, but a very important one that we will be asked to consider as a board for final approval, and we will
Has there something happened to the audio?
Yeah, we've lost the audio from the room.
Yes. While we're in the interim, welcome aboard, Dr. Hopkins. Roger Folsom in Dublin.
Hey, thank you, Roger. Well, I hope I can be helpful here.
You certainly will be.
Now, what do you do, Roger?
I run a sort of a home medical equipment, respiratory care, sleep provider business called MedFirst in Dublin.
I see. I was hunting down in Hawkinsville day before yesterday.
Well, you were nearby.
Not too far. You know Johnny Bembry by chance?
I do know the name. Yes.
Yeah. Anyway, we hunted wild birds all day long.
That's a lot of fun.
Picked up one. Wild birds are tougher than pen range birds. Do they know we've lost audio?
Yes.
Yeah, Denisha says they are working on it.
Are we okay now? Hopefully we're back and I'll go back and in the agenda here, we do have a quorum to commit to continue to conduct business today. And I'd like to call on Roger Folsom. Roger, if you can communicate to us, if you've had a chance to read the minutes of the last meeting in January 18, and in fact can recommend approval.
I have read the January 18th board meeting minutes and all appears to be in order. Therefore, I submit a motion for approval, Mr. Chairman.
Okay, it has been motioned to accept the minutes of the January 18 meeting. Is there a second to that?
Second, David Cruz.
David Cruz has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. I'd like to move to my opening comments, and the first thing that I would like to do is welcome our new board member, Dr. Hopkins, to the board and express our appreciation for his willingness to serve on the DCH board. And I'd like to give Dr. Hopkins the opportunity to introduce himself to the board, if he would, please.
Yeah, glad to be with y'all. I'm an orthopedic surgeon in Griffin, born and raised here. My family has for many generations, and I've been practicing orthopedics here for the last 35 years. I've been on the Board of Regents for the last 14 years, and after 2 terms, I rotated off, and Governor asked me to come on this board, so I hope I'm helpful. But I went to Emory Medical School, did my residency at Emory, served in the Air Force as a flight surgeon and orthopedic surgeon. And my wife and I live here. I got 2 kids and 5 grandkids. Glad to be with you. Thank you.
Like we lost the audio again.
Hope I don't have to say that again.
This is becoming a little too typical.
They need to get the system that Board of Regents has. We usually have a pretty good one.
Board members, can you hear us now?
Yes,
Yes.
Thank you.
can't see you.
I'm sorry, Dr. Hopkins, we just seem to be like, we're just trying to keep you speaking. So I'm so sorry. Would you please go ahead and make your comments to the board and introduce yourself? Thank you so much.
Okay. I'm Tommy Hopkins, an orthopedic surgeon in Griffin. I practiced here for 35 years now. Born and raised in Griffin, as has my my family for 5 or 6 generations. I went to school in Valdosta, University of Georgia, went to Emory Medical School in residency. I was in the Air Force as a flight surgeon, then an orthopedic surgeon. My wife and I have a son and a daughter. My son's got 3, and his wife have 3 kids and live in St. Simons. My daughter and her husband have 2 little girls in Macon. And so my wife and I are spending our time catching up with grandkids most of the time, but I'm still practicing. You know, Spalding County's been hit hard with the economic conditions. With the demographics here are very poor. So I know about dealing with folks that can't afford health care. I deal with it every day and have so for 35 years. So thank you for letting me be a part of it. I hope I can help you all out.
Thank you very much, Dr. Hopkins. And again, welcome. And sounds like you got a lot of deep roots in Georgia.
Yeah, I do. Thank you.
For sure. Thank you so much. Next item on my comments this morning is reference to appointing an interim vice chair for the board. We, as you know, Russell Crutchfield was moved over to the governor's office where he's the chief operating officer now. And so we created the opening for the board, which Dr. Hopkins has joined, and also created a vacancy as vice chair of the board and a temporary interim chairman, vice chair to be appointed or to be voted on this morning. And I nominate Roger Folsom for that role and would like to ask Mr. Folsom if he would accept that.
Yes, I'd be happy to, Mr. Chairman, if the board deems so.
Thank you. I would at this time solicit the board for any other nominations for that interim position.
I make a
Hearing
motion
none.
that the nominations be closed.
Second.
There was no other nomination, or did I miss something?
I was just recommending that we close the nominations and vote in Roger.
Closing the nomination.
Oh, yeah, okay. Thank you. Thank you, David. Yeah, the nominations are closed. And I'd like to call for a vote for Mr. Folsom to be interim vice chair. And all in favor, say aye.
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 Opposed? Abstaining? Hearing none. Mr. Folsom, you are appointed interim vice chair, and we so appreciate your acceptance of that position.
Thank you, Mr. Chairman.
The other item in my comments this morning is in the materials that we sent, there was some language change in the bylaws of the board where we have in the language related to conference calls, but not language relating to virtual meetings, which we have here on Zoom and whether you're using Zoom or Team or whatever it is. Our bylaws need to be and are being amended to show that virtual meetings will replace the verbiage which before was conference calls. And that verbiage will be, I'd like to review that in the materials that were sent to you, and we will call for a vote on that at the March meeting. With that, if there's any questions on any of that, I would accept those at this time. That concludes my comments, and I'll turn it over to Commissioner Carlson for his report.
All right. Thank you, Mr. Chairman and members of the board. Dr. Hopkins, thank you again for joining us. Enjoyed visiting with you last week. And thank you for those of you joining us virtually. As you'd imagine, much of our activity has lately been centered around the legislative session. In the past few weeks, we've testified before the joint House and Senate Appropriations Committees to kick off the budget deliberations. And more recently, the House and Senate subcommittees on health appropriations have taken up the amended FY 2024 bills, and we've been a part of both of those discussions in both chambers. As you probably noted, the House passed out the amended budget earlier this week and sent that to the Senate. And the House has hearings planned for the FY 2025 budget beginning early next week. We continue to be appreciative of the governor's office, OPB, and both the House and Senate budget staffs for the spirit of communication and collaboration as we work through all these matters together. I continue to thank Joe Hood, Cody Whitlock, Brian Lipton, and Rachel Lemoyne for the hard work, quick turnarounds, and repeated rehearsals as we continue to work through this budget process. As for the legislation itself, thanks to the hard work of DCH's legislative leaders, Brandy Sylvan and Caitlin Ward, all 6 of our agency bills are moving through the committee process, with one, having already passed out of the Senate last week. Thanks again to Brandy, Caitlin, and all the subject matter experts who contribute to this effort. A very distinguished group of legislators serve as bill sponsors, and we've received very fair and favorable committee assignments on all these matters. Lastly, while the legislative session is of great import to this agency, obviously, we continue to emphasize to everyone that we're also working diligently on the state's largest procurement and most robust health policy document, the procurement of the state's Medicaid managed care contract. This is an immense project with an aggressive timeline, but still that evaluation requires a great deal of thoughtful deliberation and discipline. I would like to thank our Chief Health Policy Officer, Lynette Rhodes, and our lead project manager, LaClois Bolar, for their continued leadership on this very organized and disciplined evaluation effort. And a thank you for the number of DCH subject matter experts whose experience and expertise in these fields are being applied to these evaluations. And obviously, our DOAS partnership on this effort makes all of it run smoothly and keeps us out of trouble. And with that, Mr. Chairman, I will defer to the agenda. I do want to, I know we're not on video, so maybe we'll do remarks next month, but I do want to thank and welcome our new Medicaid Director, Stuart Portman, who is with us in the audience today, but I know you cannot see him, so we'll save that for next month. And obviously Joel Presley, who joins us in Cordele at the State Office of Rural Health. We're very grateful for both of those commitments to the organization, and Stuart specifically for moving your family to the state of Georgia from Washington, D.C., where you served in the Senate Finance Committee for some time. Very grateful that Lynette Rhodes, serving as our Chief Health Policy Officer, is leading the charge on the evaluation effort and be working with you as you transition into the Medicaid to the MAP director role. We're very grateful for your expertise. And again, thank you and Joel both for joining the family. And we look forward to introducing you to everyone again in the future. So, Mr. Chairman, with that, I'll defer to the agenda.
Thank you, Commissioner. Are there any questions from the board or comments from the board for the commissioner, please? Hearing none, we will move to our agenda item today that will require us to consider for vote for final adoption. And I'll turn it over to Brian Nino, who's a senior attorney with the department. Brian, please.
Thank you, sir. Good morning, Mr. Chairman, board members, and commissioner. This morning, I present to you a proposed amended rule and regulation pertaining to certificate of need for your consideration for final adoption. This board adopted this amended rule for initial adoption at the December 14th, 2023 board meeting. This is an amendment to specific review considerations for short-stay general hospital beds set forth in Rule 111-2-2-20. Through this amendment, the department seeks to create administrative efficiencies for short-stay general hospital beds, seeking to add beds in response to the closure of a short-stay general hospital affecting the community. Again, just for edification, a short-stay hospital is a facility with an average length of stay of less than 30 days. This amended rule would provide urban and rural hospitals a more streamlined regulatory process to seek expansion of hospital beds following a hospital closure. Specifically, this amendment would allow the department to grant existing short-stay general hospitals an exception to the need and adverse impact standards set forth in sections 3B and D of this rule for facilities meeting one of the following 3 conditions. 1, a facility in an urban county or rural county seeking to add short-stay general hospital beds in response to the closure of a short-stay general hospital located within a 5-mile radius. 2, a facility in a rural county seeking to add short-stay general hospital beds in response to the closure of a short-stay general hospital located in the same rural county or a contiguous county. And 3, a facility in an urban county seeking to add short-stay general hospital beds in response to the closure of a short-stay general hospital located in a contiguous rural county. To qualify for this exception, the existing hospital must demonstrate that it will serve substantially the same patient population based upon patient origin and payer mixed data as the closed hospital, to be determined in the sole discretion of DCH. This expansion may be up for 20% of the capacity of the applicant hospital, and the application for a CON under this exception shall be filed no more than 18 months after the closure of the short stay general hospital. The exception may be requested by an applicant only one time in response to a closure of a particular short stay general hospital, unless the applicant provides written justification in support of a second request that is granted by DCH in its sole discretion. This justification must be submitted again no more than 18 months after the closure of the hospital. There was an opportunity for public comment at a hearing held on January 10th at 2 p.m. via Zoom. No comments were presented at that hearing. Written comments were accepted by DCH through January 12th at 5 p.m. Written comments were received from the following: Mayor Andre Dickens, Fulton County Board of Commissioners Chairman Rob Pitts, Morehouse School of Medicine, and Carrie Conley, Executive Vice President for Healthcare Policy and the General Counsel of the Georgia Hospital Association. Overall, commenters were supportive of the proposed amended rule. Some commenters proposed extending some of its provisions further. Ms. Conley wrote on behalf of GHA in support of the proposed amended rule and noted that the proposal provides flexibility in situations where a nearby hospital is forced to close. She noted that importantly, this is not a complete exemption from the CON requirements. Hospitals are still required to obtain a CON to add beds unless they qualify for another pre-existing exemption. Ms. Conley further noted that we appreciate the balanced proposal as part of the department's ongoing work to ensure that Georgia patients maintain access to hospital care close to home. Morehouse School of Medicine stated that it is pleased that this board has proposed changes to the short stay general hospital bed rules to recognize the need for the hospital industry to address closed hospitals and the impact such closure has on access to care for the communities served by the hospitals. Further, Morehouse is supportive of the overall goals of CON regulation and its foundational concept of ensuring access to underserved communities. Morehouse suggested additional changes to the proposed rule to address other services affected by closures, including those related to emergency departments and other outpatient and ancillary services offered by the hospitals. While acknowledging that allowing for closed hospital beds to be added to existing hospitals may address the dispersion of inpatient demand from a closed hospital, Morehouse further stated that adding beds at existing hospitals at other locations alone simply will not address the needs of the local underserved communities that the closed hospitals serve. Morehouse also expressed concerns that the dispersion of beds to only existing providers is anti-competitive and eliminates the opportunity for any new hospital facility to address the gap in services left by hospital closure. Accordingly, Morehouse proposed amended language in this proposed rule to allow for the development of a new hospital, and that an application for a CON under this exception should be filed no more than 24 months from the closure of a short stay hospital. Mayor Dickens stated that while we do not oppose these changes, meaning the changes in the proposed rule that's before you, we feel that it is an imperative to modify the proposed CON rule change language to allow for the development of a new or replacement hospital as an additional critical option to serve the communities impacted by the hospital closure. Mayor Dickens further addressed support for the proposed changes that are proffered by Morehouse. Chairman Rob Pitts also provided similar comments. Mr. Chairman, the agency is very thankful for each of these comments. I'd like to take a moment and particularly address the Morehouse comments with support of the Mayor and Chairman Pitts. In response to the comments that we received from Morehouse, agency leadership reached out to Morehouse directly and other stakeholders to learn more about their proposals. We're going to be continuing those discussions in the coming days and weeks and further learn about them and provide informational assistance as we possibly can. But this proposed amended rule is intended to provide administrative efficiencies for existing hospitals to increase capacity in an expeditious manner in the event of a hospital closure, rather than amending CON rules for new hospital construction. But again, we are going to continue our discussions with Morehouse as an important community stakeholder and continue to provide informational assistance in their efforts, and we'll report back to this board regarding those efforts. In conclusion, Mr. Chairman, this amended rule would create a streamlined approach regarding CON following a hospital closure, help ensure access to community health care in the event of a hospital closure, and creates a balanced yet efficient approach to agency reviews of qualifying applications for CON following a hospital closure. Mr. Chairman, board members, I respectfully request your favorable consideration of this amended rule for final adoption, and I'm certainly happy to answer any questions that you may have. Thank you.
Thank you, Brian. Any questions, comments from the board, please? Hearing none, I thank you, Brian, for providing the written copies of the written comments
Yes, sir.
in advance. We've had a chance to review those, and thank you for your review of those with us, and commend you for your follow-up work that you're doing, because there are several items in that public input that certainly deserves, as you're doing, further study and conversation. And so we thank you for that.
Thank you, Mr. Chairman.
With that, if there's no questions or comments for Brian, is there a motion for approval for final adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Mr. Folsom has moved for final adoption. Is there a second?
Tommy Hopkins, second.
Dr. Hopkins has seconded the motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much.
Thank you, Mr. Chairman.
With that, it concludes the items that we were to address today. Does anyone on the board know of any new business that needs to come before the board at this time? Hearing nothing, the meeting is adjourned. Our next meeting will be March 14. And again, thank you so much for your participation, and our apologies again for technical problems, as someday we'll get our arms around this, hopefully. Thank you. Have a good day.